Hello once again and welcome to Health Matters on Channels Television. I am Mary Alale Yusuf. Acute kidney injury, previously known as acute renal failure, is not as a result of physical blows to the kidneys or a fall, as the name may suggest. It is a loss of kidney function, which may occur in any age group. Its progression and outcome is affected by the duration and severity of the occurrence. Although there are diverse views for the management of the injury, certain concepts are generally accepted. The recognition that the disease is a process which evolves from early injury to severe damage and kidney failure. Global statistics for acute kidney injury, unfortunately, are little known because of underreporting, amongst other things. But Nigerians would agree that more cases of kidney failure are being reported now than before. Our guest today is Dr. Toyin Amira, a consultant nephrologist at the Lagos University Teaching Hospital, Idiaraba. You're welcome to the show.
Thank you. Hello, viewers.
Let's start by reminding ourselves of the function of the kidney. What's it doing there in the body?
The kidneys have several functions. They have excretory function, that is to eliminate the waste products generated within the body, principally urea and creatinine.
Okay, those are waste products.
They are waste products. And also help to regulate the water content of the body. That's why when you take a lot of water, you pass a lot of urine. The kidneys also help to regulate blood pressure by producing certain chemicals or hormones. It also helps to keep the bones strong. The kidneys also help to the marrow to produce enough red blood cells by producing certain hormones. And then, of course, when we take our medications, it is the kidneys that help to excrete the byproducts of those medications called metabolites. So principally,
it's working really hard in the body.
It is, but so most people don't know.
That means that if the kidneys aren't working, there are implications for bone formation, implications for blood formation, implications for high blood pressure.
Certainly.
That's awesome.
Yes.
Okay, so we're talking about this injury. What is the cause of the injury?
Now, acute kidney injury, which is what we are discussing today.
Just a minute. Why did they change it from kidney failure to kidney injury? That's a bit misleading, isn't it?
Well, it's not misleading. It was changed so we can have a universal definition. So if you're talking about acute kidney injury in Nigeria, you are on the same page as the person in the US.
Okay.
So for uniform definition, and then to show that it's a continuum, you start from risk, and at the end of the continuum is failure. So the whole idea is to identify early those at risk of developing acute kidney injury.
Okay, so let's first talk about the cause and then we'll move to the risk factors.
Now, the causes of acute kidney injury, are divided principally into three major categories. The first, which is the most common, is conditions that reduce the blood flow to the kidneys. May I say that the kidney takes 1/4, 25% of what the heart generates, while all the other organs share the 75. 75.
Let me just ask, can you tell us how much the liver takes? Because I know that these are two very important organs.
Well, I know that I cannot specifically say. I know the brain has its own share, but
25%,
25%, because the kidneys are really working to keep the inside of the body chemically balanced.
So if
so that all other organs
or reduced, then maybe to 12 or so.
Oh, you will have acute kidney injury. Yes.
What would cause the flow to reduce or stop?
Many things. Now, the flow can reduce if there's massive blood loss from any cause. Accidents, post-delivery, anything that causes massive blood loss will cause acute kidney injury. Then massive fluid loss, as in severe diarrhea. The individual is dehydrated, either severe diarrhea with vomiting. In cholera, most of the cases die from the acute kidney injury.
Not really the cholera itself.
Yes, because it causes profuse diarrhea. They are so dehydrated and they come in shock. So, diarrhea. And then situations in which the heart is not working well, heart failure. So it won't be able
because
to...
of the pumping of the blood.
Exactly. So it will not be able to generate enough. Then infections, what we call sepsis. In sepsis, there is low perfusion of tissues and organs, and the kidney is also affected. Then hypotension or shock. That is when the blood pressure drops from whatever cause. Once the blood pressure drops, it's not able to give enough blood flow to the kidneys, whatever the cause.
So these are all potential dangers to the kidney. But is it just the blood flow that is the cause, or are there other things?
There are other things. The other things are toxins.
Okay, you mentioned infections and then not toxins as well.
Toxins that directly damage the kidneys. They could be drugs, some of the drugs we use, some of our orthodox medications. Like cancer drugs, like some antibiotics, especially gentamicin. Then you have herbal medications in this environment. A lot of people indulge in herbal medications. They don't know the constituents.
These are the things that people sell about.
Exactly, and all those, they are medications. You don't know what it is. There is no dosage. People just take it arbitrarily, and you don't even know the constituents. So a lot of these things damage the kidneys. Then the so-called holy water, green water, blue water, they contain metals. Some of them contain copper sulfate.
I confess I'm at a total loss. Green and blue water.
Yeah, some religious sects, I'm not going to mention.
They take colored water.
They say it's holy water. And it's been known that some of these things contain heavy metals that directly damage the kidneys. Then, of course, infections. Infections like yellow fever, Lassa fever, the recent Ebola fever. Apart from causing massive bleeding, they also damage the tissues.
That's a whole lot of things.
In fact, acute is a very wide area.
Okay, so does it come with symptoms?
Yes. In the mild forms may be asymptomatic.
That means the person doesn't know.
Yes, the person doesn't know, he's still passing urine. But the severe forms come down with failure. The mild forms are picked up when you monitor kidney function. And the test for kidney function is very simple and cheap. You do your serum creatinine, that's creatinine in the blood, urea level, and then check the urine for excretion of
These are
protein.
all very big words. Can you break it down for us? Somebody comes to the hospital, wants to check kidney function. What do you take from the body?
Blood, urine, and in some instances you do a scan to check the structure of the kidney.
And all this takes how long?
It doesn't take long. Blood, I take your blood, I take it to the lab and I analyze. Within a few hours, the results are ready.